Hello, welcome back. Thanks for joining today. I wanted to talk about biosimilars and hopefully answer some questions that you may have about what the term biosimilar means and why we use that word in rheumatology. So, if you're a patient on a medication that's either an infusion given through your veins or a self injectable medication that you can deliver yourself on your own schedule, these medications have a patent. Just like everything else, there's a brand name or a brand version. And in 2023, there are many of these products that are becoming biosimilar. So we don't really use the term generic because they're not generic in the terms that we think of oral medications. It's not like Aleve or naproxen, but we use the term biosimilar because they're the same active ingredient, the same entity in a sense, but packaged differently and made to be similar to the original or the brand version. So these medications go through very rigorous testing, years, to be able to make it from concept to market and delivery to where a patient actually gets the medication. So these are not new, they're not understudied in a sense. They go through very rigorous drug trials and FDA approval, of course. But these medications go by a different name and they're often marketed or manufactured by a different company. So, what's going to happen when the patents of the brand version expires is that the biosimilars then can present themselves to insurance companies and essentially offer their product for a cheaper rate than the brand version. So some insurance companies right away will switch and say that we prefer to use the biosimilar version versus the brand. And some insurance companies will give you the option. And a lot of times the option depends on the prescriber. So in my case, myself, which one I choose. Or if the patient says, I want this one specifically, there is that option as well. However, I do want to make a very important point that if you are on a medication that has a biosimilar option, you are not obligated to switch just because your insurance company says that that's what they prefer. So as prescribers, as physicians, it is our job to fight for you, the patient. And what that means when it comes to medications and insurance companies is that we can appeal and say, no, my patient has done very well on this drug, and we are not switching to the biosimilar. And express medical necessity is what we call it in physician language, doctor language, that you, the patient, stays on your prescribed product. So just because these options are coming to market does not mean that you are forced to take them or to switch your prescription. So I'm here today to try to acknowledge or give you a little bit of heads up that these medications will be coming out. They're going to be available. Now, for people who are starting brand new, it doesn't really matter which one you choose. It doesn't really matter to say, well, I want the brand because that's the one I want. Biosimilars are just as great of products and have their own role in rheumatology. That being said, we don't want to be afraid to use them either. They are good products and, like I said, have gone through very rigorous testing, and they essentially work the same way as the branded version. But we don't necessarily have to take you off the branded version if that's what you're already taking and doing really well with. So it is okay to ask your doctor or your prescriber, nurse practitioner, physician assistant, whoever you see, that you want to stay on the same product that has worked for you. And so we then will have to advocate on your behalf. So again, biosimilars are just as great as the original branded product. and will become much more of something that we see in 2023 because some of the major patents are expiring this next year. And so these medications are going to be out there. They're going to be used and we're going to embrace them. But we also have the option to keep you on the same product that has been working for you. So that being said, this is just a little bit of heads up that new things are coming in 2023. And also, this is a really exciting time to be a part of rheumatology. We have more options than ever before to treat you for your autoimmune condition. And if you're on the verge of deciding, do I need to see a rheumatologist? Please schedule that appointment, because it's so much easier to say that you don't have something or to say, yes, you do have this and we can treat you. So if you're contemplating seeing a rheumatologist, we are here and available for you. And seek one out in your town. And let's make 2023 the year that you focus on your health and getting things back on track so that you can do the things you want to do. All right, we'll see you next time. Have a great one.